Trump's second administration promises to bring extreme changes to just about every part of government, and health policy is no exception. We're joined by stat reporter Sarah Owermohle to learn more about what a Trump presidency will mean for all things public health. Welcome, Sarah.
Thank you for having me.
Glad you're here. Let's start with abortion, which of course was a major election issue. Trump has said he would not sign a national abortion ban. Do we have any indication at this point that he's going to stick to that promise?
We don't, except for his word that he would veto a national abortion ban, but he caveated that by saying one would never get to his desk anyway. Now we know that Republicans are in control of the Senate, are poised for control of the House. So we're talking about a different environment now. Not saying that that's possible, but it's more possible. That said, I think that this election cycle has shown Republicans how much voters don't want to see a national restriction. So I think there's other ways that a Trump administration is actually going to change abortion access. There's plenty they can do without a national ban on the table. They can, reinstitute restrictions around the abortion pill mifepristone. They can withdraw Biden administration rules about covering abortions under emergency care, even if a state ban is in place. So there's different ways that we could see abortion access and law change anyway.
So Trump is closely associated with Robert F. Kennedy Jr. in the closing months of his campaign, alarming health experts given Kennedy's status as an anti-vaccine activist who's embraced debunked conspiracy theories such as vaccines cause autism. So what do we know about Trump's plans on the vaccine front?
On the vaccine front, we've gotten a few more details over the past week or so. Trump has said that he would let RFK Jr. go, quote, wild on the Food and Drug Administration and the Centers for Disease Control and Prevention. One of the things that's come out in the past week or 2 weeks is that he wants to look at, the protections that certain vaccine makers have over liability or in other words, being sued for injury. Those protections, especially during a pandemic emergency, are limited, only are for a certain amount of time, but that's been a big sticking point for RFK Jr. when he says that vaccines are not safe. Another thing that he has kept repeating and that Trump world people keep saying is that he just wants to look at the data. He just wants to see all this data around safety and risk. So that's the most that we know right now. But as you said, there's been some troubling rhetoric in the past from him, so people are on guard.
What about health insurance? The Affordable Care Act, otherwise known as Obamacare, has been a political sticking point for Republicans for years, both before it passed and then again after, when they tried to overturn it during the first Trump presidency. But does Trump have the appetite to actually go again at the ACA and try and overturn it?
In short, no, not overturning. I don't think anyone really wants to revisit the repeal and replace fight, but this is another place where we could see smaller changes happen that do end up significantly changing people's care. Some of the things that have been floated is making less expensive plans for healthier people. How that would be done is a little bit problematic because then those costs for people who are chronically ill or older could shift entirely to them. That's why, all of us are required to have the insurance. And some of the other things that have been floated are what are called short-term plans, so temporary plans that people can get as a holdover, or if they are in a job and they're self-employed. Problem with those is that they don't have to necessarily comply with all of the ACA rules around other plans. So I think we're going to see little nips at ACA, not a full repeal fight.
Okay. So we have just a short amount of time left. Is there anything else you can tell us that you're watching for in the health beat?
Yeah, I think one thing that's prominent to me is just what the pandemic preparedness and overall infectious disease strategy is going to look like. He ended his presidency during the COVID-19 emergency. There is a lot of bipartisan interest in having a stronger plan, but how does that look for the country? And then also how it looks for how we deal with the world and what kind of aid we give to the world in these situations.
Well, Sarah, thank you so much. Stat reporter Sarah Owermohle.
Thank you.
For daily access to Boston Globe Today, all segments and episodes are available on demand in the Boston Globe app by clicking Watch.